we're not making you a bodybuilder. We're making you healthy.
That's the first thing I tell people.
He goes to the doctor. The doctor says, you have high cholesterol. You got this. We need to break that up. Here's whatever they're going to do for him. He's going home and he's taking that. You got something going on with your heart. You got high blood pressure.
Right.
The doctor you're instantly doing what the doctor says. You got high blood pressure. Here's the blood pressure medicine. Take this. Guy's home doing it. So testosterone runs in the body.
Yep.
Not for everybody in the sense of it works perfect. Some people, especially in today's world, it seems like everybody's low. But my point is, you got somebody who specializes in this for you guys, and you say, hey, this is what's going on. Now you're causing problems. You got now this is going to probably cause issues even beyond. I get your energy is low, you're 200. So how do you explain to them going, we're not making you a bodybuilder. We're making you healthy.
That's the first thing I tell people. I'm like, listen, I go, because they look at the page and whatever, and they might think it's all bodybuilders. I'm like, it's not all bodybuilders. I'm like, literally, like, probably my population for patients of bodybuilders is maybe 15%. 15%, 20 with all athletes involved. So at that point, I'm like, it's not the bodybuilder that comes to me because we don't give extreme doses. It's the everyday person or the executive or whoever it is that just wants to feel good. They want to look good. They want a better quality of life. They want to perform better in the bedroom, right? Or they want to get lean body mass or lose weight. And that's what I describe to them. And I tell them, I'm like, listen, I'm like, everybody has, when people say steroids, because I get these comments all the time, right? Steroids, you guys are steroids. I'm like, listen, if that's the case, you got steroids in your body. She's got steroids in her body because we all produce testosterone, and that's an anabolic steroid. So, yeah, it's not coming from an outside source, but your body ain't producing it anymore, or it's producing very little of it. And you were feeling this. It'd be like, just like you said, it's like anything else. If it was a cholesterol medication, they told them to take it, blood pressure medication, depression medication, SSRIs, they're going to take it without even blinking an eye. I think a little bit more people are more educated now. They go Google it now. But like, if your testosterone is low, then you want to do this. But here's the other challenge is talking them about debunking these myths that have been ongoing for so many years. And now we finally know that these are not factual. These are lies. Okay. And just like right now, like, on testosterone, there used to be a black warning label that said it would give you a heart attack. You'd be at a high risk, right? Stroke, heart attack, cardiovascular disease. They've removed this label from testosterone now.
Yeah.
The FDA did. But there wasn't no big press release from the FDA saying, hey, look, we found out that testosterone's not bad for you. It's actually beneficial for you, right? At healthy doses. I'm not saying if you take a gram or 2 grams, that's healthy, because it's not. You're just overdoing it, right? But at a regular medical dose and getting you to an optimal healthy level, like, that's doing more for you. It's not going against you. But it's got to be done properly too, because if you're not balancing hormones along with testosterone, then you could be doing yourself a disservice, or the doctor's doing you a disservice. And that means that when you inject testosterone, take it from outside source, whatever it may be, hormones convert into other hormones. And I always talk about how it converts into estradiol or DHT. Those are main two that you're really going to look at.
Right.
And at that point, making sure that those things are fine too. But once you're locked into that dose and it's all good blood-wise, and then now you're feeling better, if you're consistent with the dose, then you're always going to feel like that and have that good feeling. If you're not, then you're going to be like up, down, up, down, up, down. And you don't want that either. You got to be consistent.